Hi, this is Scott Kreitzberg. I'm a board-certified plastic surgeon here in Tulsa, Oklahoma. Today I want to talk about liposuction. I want to talk about the 4 key steps that go with liposuction. So the first step is basically putting in fluid, also called tumescent fluid. We use a very small cannula similar to this to put the fluid in. It's really just about a millimeter to 2 millimeters in size. That fluid allows us to gain more space for doing the liposuction. It also cuts down on bleeding that could potentially be with liposuction, which means less bruising and less problems with that. The next step is basically using a larger cannula. These larger cannulas are about 4 millimeters in size, so they need basically a small little incision to be able to accommodate this cannula going in. The next step is separation of all of the fat from the remainder of the tissue. We do this without suction. The third step is basically suctioning the area, and this cannula, like this, is connected to a vacuum in a tube, and then that pulls the fluid out as you're doing the liposuction, as well as all of the fatty tissue that we no longer want in these stubborn areas. We're able to basically target specific areas to remove that fat at specific depths. As we go into the deeper layer, we kind of take down the bulk of the area. As we go into more of the superficial area, we're able to contour and make specific areas thinner, give little impressions in the skin, allow for better shadowing of the skin, different things like that. The last step, I think, is one of the most important steps, and that is kind of that redistribution kind of feeling step. In this sense, we use the similar cannula, but this time without suction. That allows us to go through all of the area. We're able to kind of feel with our hand to make sure that we've removed all of the tissue evenly, except for the areas where we want it to maybe be more a little indented, to have that subtle change that we want to kind of give that improved shape. This also allows us to kind of redistribute some of the fat that might be remaining. We want to leave a little bit of fat in the area so that it looks normal and natural, but more contoured. So removing all of the fat is not what we're after. We're looking to try and make a very thin layer of fat that goes over the top of the muscles to very accentuate them. So those are the 4 key steps that go with liposuction. It's 1, infiltration of fluid. 2 is kind of the separation of the fat from the remainder of the tissue. 3 is basically aspiration or removal of the fatty tissue. And then 4 is kind of redistribution to make sure that everything is nice and smooth. There's no contour irregularities. If you have any other questions about liposuction, feel free to give our office a call or come in for a consultation.